Hi, good morning. I'm Varda Singhal from University of Nebraska Medical Center, and we have Dr. Vinod Thourani from Medstar Health here with us. Thank you, Dr. Thourani, for talking with us.
Thank you so much for the invitation.
So we would like to know, what do you think is the future of TAVI in low-risk population?
So right now, as you know, there are two trials going on in the United States. One based with Edwards Life Sciences and the SAPIEN 3 valve, and the other one with Medtronic and the core valve. And both of those trials are almost close to enrollment, and the anticipation of their presentations will be in 2019. Maybe at ACC 2019 next year. So it'll be very exciting to see what happens with both of those trials.
And what would be your advice for fellows interested in pursuing structural heart disease, transcatheter interventions in future?
So I think this is a very crucial time for residents across the board in cardiology, interventional cardiology, and also in surgery. And I think that the structural heart, we believe, will be a major play for what happens in the future. And it's not just for transcatheter valve, aortic valve, but also the mitral that are coming down the pipe. In your current training of 1 to 2 years of interventional training with coronaries and STEMIs, I don't think you have enough time to do that, to really dive into it and take care of these complex patients. My advice to you is to take an additional year and really focus on structural heart, because I think that's where you're going to learn how to do the 3 Mencio and how to read the echoes and how to get that special training for aortic and mitral disease. And so I would pursue some of those super fellowships in structural heart. So I think the field is wide open. I think it's going to be very expansive. And I think that this is the right time to be in it, because as mitral technology and tricuspid technology are coming for the future, now is a perfect time to be in interventional cardiology or in surgery, interventional cardiac surgery, or cardiology in general.
And so there's a lot of overlap between cardiac surgery and interventional cardiology when it comes to structural disease. How do you think the two teams can work together?
So I think it's critical that they work together. And right now, in aortic valves, they have to work together. The surgeon has to be in the room. But it's more than that. I see the patients with the cardiologist. We see them pre-op together. We put their slides together. We see them post-op, and we do the procedure. I think the more that we work together, the better the patient does. And I think that that's really what we have to share our knowledge. I think the days are gone of when it should be interventional cardiologist versus the cardiac surgeon. We have to find, and we've shown successfully, that we can work in the sandbox, and we have to, your generation and my generation needs to show how we can really do that well.
Okay. Thanks a lot, Dr. Thourani, for talking to us and taking time out. For more videos like this, please go to www.youtube.com/FITsontheGO.